Do I start? Or
just a minute, madam. I'm going on live. Yeah, Nishant, we are on live.
Okay, sir. Good evening, colleagues. Good evening, all the participants to join today's webinar on Shield Connect page. And today we have Dr. Shobhana Mohandas, and she is going to take a session on alternate therapy in menopause. So before we go to webinar, let me share our digital page, Shield Connect. So this is our page, shieldconnect.in, where you can find various sections like blogs, webinars, awareness page. In blogs, you can find all the articles related to PCOS, myoinositol, and male infertility, and various topics written by the eminent doctors. There is a webinar section where you can see upcoming webinars as well as past webinars. In upcoming webinars, like right now, you can see alternate therapy in menopause by Dr. Shobhana Mohandas. So when you click on see more, you will join this session. And there is one more page, awareness page, where you can see a immune booster page where we reintroduced Rodimine Mu. And there is PCOS awareness page where you can find all the details regarding PCOS topic in various regional language like Tamil, Hindi, Telugu, Malayalam. Then there is our key leader page, key opinion leader page, where you can find all the doctors who are linked with Shield Connect. Then there is a very special page for different days, like for example, hypertension day. So you can find all the details regarding hypertension days videos. So this is the Shield Connect page. And now let me introduce our special guest speaker, Dr. Shobhana Mohandas. Ma'am is MD DGO in FICOG, deep endoscopy, chief consultant gynecologist and laparoscopic surgeon in Sun Medical Center, Thrissur, Kerala. Ma'am is also president-elect in Indian Menopause Society for 2022. Ma'am is chairperson in Women Doctors Wing, IMA, Thrissur. Ma'am is also chairperson in Mission Pink Health, IMA, Thrissur. Ma'am was past vice president, secretary general, and website committee chair, as well as quiz chair in IMS. Ma'am is also member of FOXY, FNDC, past member of FOXY Endocrinology Committee. Ma'am was also South Zone coordinator for FOXY in heteroscopy workshop in 2011. Ma'am was also vice president in IMA Thrissur in 2016 to 2017. Ma'am is also author of 2 textbooks in gynecology and also contributed various chapters to several textbooks and invited speaker at more than 200 venues. So I welcome Dr. Shobhana Mohandas. And colleagues, if you have any queries, you can post in the comments section. So ma'am, I hand over you this session. We are very glad to have you on our platform.
thank you, Shield, for trying to enhance academics and conducting so many sessions and putting them together in the website. I know it's a thankless job, but I hope in this digital age, your endeavor will be appreciated by all the gynecologists and the coming generations forever in the digital platform. So here you have suggested that I select this topic on alternate medicine, which is also close to my heart because I've given a talk on this at several platforms. So I have collected a conglomerate of my, presentations, and here you go. So, okay, we know this is my hospital in Thrissur. We know that menopause is, the main thing that worries about we worry about menopause is patients coming with hot flashes. They come with all sorts of symptoms, but when you go and slowly go into the depth of the history, you realize that they do have hot flashes, but they never thought that was the cause of their problems. So they will come with stomach pain, they will come with bloating of abdomen, and then when you talk to them for 10-15 minutes, that's a long time, by the way, then only they will come, oh, yes, doctor, I feel that I have to put on the fan all the time. Urinary problem is also another problem with this. Bone problem, you won't find stooping old men, but you will find stooping old women. That's because osteoporosis is more in women. Irregular periods, palpitations, backache, dry skin, hair loss, all these are estrogen related problems. And another thing is long term problems like, heart attacks. Till menopause, women do not just die like that, but after a long time, after menopause, women die of heart attack just the same as men. So all these memory loss, diabetes, hypertension are all related to menopause, though not related to estrogen. Plus, your children go away from your house, you're worried about getting ill, no income and more illness. So all this leads to depression, sleeplessness, and crying spells. To some extent, all this, you just feel that you have to sleep all the time. By God, I have so many problems in life. So all these menopausal problems to some extent can be cured by MHT. But there are many, many, many instances where you cannot have MHT for everything. Now, there are women who come to you after 55 years of age and they come with hot flashes. You cannot give them HRT because the window period is gone. If you give HRT after 55, they will get heart attack. Women with history of breast cancer, especially estrogen receptor cancers, you cannot give HRT. Women with metabolic risk factors but cannot afford transdermal estrogen, natural progesterones and all that, there also you are worried about giving this. Scare of hormones. Even if you're a doctor and you give them hormones for 1 year or something like that, even the hormones, there is no risk of cancer for 5 years or 10, even more than that. How much ever studies say that these things don't happen, people just don't believe you. They are scared of hormones. When you give it for a long time, you need something. They get scared, but they won't get treatment because they know how it is to, that their symptoms are because of a problem and that problem is solvable. That much they know, but they are not willing to take it. Then there are some contraindications like infarction, breast lump, undiagnosed vaginal bleeding, primary severe. There are so many people who come back after stroke. People don't die of stroke these days. They do come back to you. So these are the indications where you cannot give hormones. And so, yeah, and I already said that. So you have to go back to Hippocrates. Hippocrates said, let food be thy medicine. That means you have to go back to food. Instead of going on loading, you concentrate more on food and less on medicine because people are feeling they are having that scare of medicine. So you have to go back to your roots and go back to your medicines. So how can you give medicine in the form of food? That is phytoestrogens. Phytoestrogens are plant estrogens. They are polyphenolic, non-steroidal plant compounds with estrogen-like biological activity. They will act only on certain receptors, beta, and that will remove your hot flashes and all that, but it will not stimulate the endometrium as much as the normal estrogen does. Isoflavones, lignans, flavonoids, and stilbens. These are the 4 types of phytoestrogens that are available. How did it all start? In 1940, there were some sheep grazing in the clover farm, and what did they find? They were not breeding. So they became infertile because they were eating red clover. And red clover contains spermonectin and biocanin. So that had some property which was interfering with their fertility mechanism. And so they realized it contains estrogen. That's how all this thing started. Why are the plants having these phytoestrogens? It was supposed to be a part of their natural defense to control female fertility. So what? These animals won't eat them up. There are more animals, they will eat more plants. So you make them infertile by producing phytoestrogens. So You have less animals and more plants. So it was supposed to be a natural defense mechanism, So this is all the 7 beta estradiol and genistein, biocanin, formonectin. Most of them have similar, molecules, but just small differences are there. We also find that Japanese women had less hot flashes than Western women. So we thought that substituting phytoestrogens in old age can help, but that also was not found to be true. The Japanese women have been taking phytoestrogens from childhood. Those Japanese women who start phytoestrogen late in life do not have the same protections. So what we find is that this protection, for it to act, the people have to start taking phytoestrogens from childhood. So there are some studies who say that also. This is again a repetition that there are many types of phytoestrogens. I think this you can get from books. What we as gynecologists to advise our patients, we should know that pulses, moong beans, sprouted beans, Bengal grams, your chana masala, chole bhature, all your methi leaves and all the fruits, they will have phytoestrogens. So isoflavonoids are found in beans of legume family, with soya beans is a major dietary source. You ask them to take soya, that will help them. Lignans are found in cereal brands and flax seeds. Comestans are found in peas, long beans, alfalfa, and clover sprouts. So all these things are available. So you ask your patients to take chole bhature, they will get phytoestrogens, or soya beans or lentils. Bean sprouts, spinach, clover, sunflower seeds, cereals, fruits, and vegetables. So the highest amount of lignans is found in flaxseed. Tilka, tilka gola is very common in many of our shops, and that sesame has a lot of lignans. Chickpeas have got a lot of lignans. Peas have got a lot of lignans, and rice also to some extent, then all the others. But these are the highest ones are flat. So lignans will have phytoestrogens which will last a longer time. Isoflavones will have phytoestrogens which will act fast, but it will not last a long time. So it would be a good idea to mix phytoestrogens of two types. One is isoflavones and the other is lignans. So they will both act fast and plus it will last a longer time. See, when you look at the isoflavone content, the earlier what I showed you was the lignan content. Now, this is the isoflavone content. That is a fast-acting phytoestrogens. It is highest in soya bean, even more in Bengal gram, green gram, and black gram. So all these things, green gram, you know that we have the cherubire, we call in Malayalam, I don't know what you call in. It's a small thing. So all these things will have isoflavones. So Bengal gram will have, and green gram will have more of isoflavones. Soya beans will have more of lignans. Flax seeds also will have. Now, overall phytoestrogens high in flax seeds. You can make idli of all soya beans. Soya beans, either as beans or as nuggets, will have a lot of things. Same. Then you have it in garlic, sprouted beans, dried apricots, almonds, your own chickpeas, peanuts, beans, and onions. So all these are good sources of your own blueberries, jamun. It's not available anymore, I think, in most cities, but it's also a good resource for phytoestrogens. Now there were a lot of reports that when you substitute soy nuts for non-soy protein in a diet and consume 3 or 4 times throughout the day, it is associated with a decrease in hot flashes and improvement in menopausal symptoms. So you eat more of soy as protein instead of your dal or something else, or even fish or whatever. You substitute it with soy, then hot flashes will come down. Now, this is the estrogen tablet that this Shield people have, and I searched on the net, and I found that it is a mixture of standardized extracts of these three things. But basically, the studies are saying it's not basically estrogen by itself. So you can't compare estrogen with estrogen, although it is called estrogen. So, but they have basically two randomized controlled trials are there. The numbers were small, 31 with estrogen and 33 with placebo. And all the Kupperman menopause index that evaluates 11 symptoms of menopause, which I had already told you earlier. Vaginal dryness, melancholia, vertigo, fatigue, all those pains, aches, everything related to menopause, all that was better with estrogen and not there with placebo. The exact effect and what the content is, how much estrogen, comparative study of estrogen with our own estrogen is not there because this is basically not an estrogen. And but in my own patients, whenever I give estrogen to them and they are happy and they reduce their hot flashes and they are in my pocket, they don't want to continue with the hormone therapy anymore. There I do switch over to estrogen because they are scared of eating estrogen for a long time. Not only that, they get withdrawal bleeding, which most people don't like. Because when you give estrogens, you have to give progesterone along with that, and that brings on withdrawal bleeding. And older women, they do not want periods. And when you switch over to estrogen, I find that these patients continue not to have hot flashes, but they do not have their bleeding. Long-term studies I do not have on this, and my patients whomever I've given only are 1 or 2 years old uh, with this therapy, so I cannot give you long term safety effect either in my practice or from the literature. Now, they had studied a safety profile on estrogen in the European Food Safety Authorities, just like FDA in America, they have one like this in Europe, and they did find that it is safe, and they asked for the liver parameters and everything, and they found it is safe. That is there. Now to go on to the other products, some 45 women have been studied on 100 milligram of soy for 3 months. The hot flash percentage decreased from 100 to 31. And it even improved mood as well as vasomotor and general menopausal symptoms. So that much improvement is there. And the breast cancer was not affected according to this 2004 study. But actually, apoptosis mitosis ratio were not significantly different. But basically, it's the progesterone which causes breast cancer. So why are you worried about breast cancer in phytoestrogen? Because it's basically not the estrogen that is causing the breast cancer anyway. 1 minute. Hello, can you hear me? Hello?
Yes, madam.
Hello,
Yes,
can
ma'am.
you hear me?
Yes, yes. You are
Yeah,
Yes,
audible.
my
we can hear
computer
you
had
now.
gone off in between. Yeah, okay. So in 2004, there was a midline database for the year, this 75 to 2004. And they collected that much of data. Imagine how many people would have worked on this. And they found that the isoflavones effect on hot flashes is variable and inconsistent. And they found there is only modest and delayed improvement of symptoms with black cohosh and vitamin E. So again, there was an RCT with 389 participants. And they said that they actually looked at the bone effect on BMD. Can you do the BMD for 389 patients and put them on a study? It's not so simple in India, at least, but they found that there was a positive effect with phytoestrogens on BMD. So this is 2007 article. Now, a systematic review and meta-analysis of randomized control trials. So many RCTs have been done, and there is a meta-analysis of those RCTs. And they found that Some studies had found a bone sparing effect on soy isoflavones, and some were finding a difference actually, but others were not finding. So, because there were inconsistent results from various studies, the reviewers conclude that isoflavones are not effective in decreasing bone loss. But again, back to 2007, they found that it can even reduce your weight. Isn't that a good thing? All patients want to eat a lot and not exercise and reduce their weight. So administration of a diazine-rich isoflavone A-glycone extract, that is A-glymax, whatever, it's supposed to be reducing body weight. Wow. I would have loved to have believed this, but I don't know. Just popping pills cannot reduce your weight. But it does reduce the plasma leptin secretion and increases the plasma adiponectin secretions. Maybe you can try it out. I don't know. Again, just like estrogen, soy isoflavones also, because it's an estrogen, it will lower the fasting blood glucose and insulin levels in postmenopausal women. So 100 milligram of soy isoflavones and conjugated estrogen 0.625, both can lower the fasting blood glucose levels. And it will increase the IGF levels in American women or whatever. Same as conjugated estrogen. The lipid profile, 60 women were studied. And isoflavones derived from trifolium or whatever, it was supposed to be an attractive alternative for high-risk populations that fat women and abnormal lipid profile people where you can't give estrogen, then you give isoflavones. It's supposed to be a very good alternative. And they had actually assessed the parameters at baseline, at 3 months, and at 180 days. Imagine calling those patients again and again and doing all this effort. So that much of efforts they say they have taken. Now, let me tell you how it acts and why these variations in studies come. Isoflavones, coumacenes, and lignans, they are converted to glycosides and glycons. And these are converted to equal by the gut bacteria. Can you see the gut bacteria there, which is converting the diazine and genistein, which are products of glycosides and biocanine. All these things are converted to glycons, and these diazine and genistein, the end products, are converted by gut bacteria into equal and ODMA and p-ethylphenol. So what happens is you need enough gut bacteria for the final conversion. So X patient will have some bacteria, Y patient will have other bacteria. So how much ever the dose cannot be really calculated because it depends on the gut bacteria of the patient. So what we can do is ask the patient to take a lot of curds along with this, or you can give probiotics with it. That's a good idea. Now, it's difficult to assess the estrogenic activity of phytoestrogen because it also inhibits aromatase, and it can have increased, which can have increased estrogenic or decreased estrogenic activity. It will inhibit the tyrosine kinase affecting steroid synthesis, and also bacterial flora affects the metabolism of phytoestrogens, which I have already told you. So all these enzymes and their levels also affect the estrogenic activity of phytoestrogen. So that is why it's difficult. What will you actually calculate to say that this much estrogenic activity is there for this particular product? What will you, tyrosine kinase, all those variabilities are there. Another problem was when all the studies were calculated, even though the label will say it is giving you so much of isoflavones, they had studied 35 supplements, and out of that, only 14 were found to deliver more than or equal to 40 milligram of A-glycone isoflavones. And you need at least 60 milligram or 100 milligram to be vis-a-vis with 0.625 milligram of, your conjugated estrogen. 6 had delivered even less than 10 milligrams. So this is why so many variabilities are there, so they cannot make a calculation. Another problem is storage of soya beans increases the levels of isoflavones. So one company will store the soy isoflavones for a long time. They will get more out of it. Some company which will use it immediately, they will get less out of it. So how to quantify all this? It's very difficult. And again, the product content of the phytoestrogens are not accurately labeled in the majority of the products. Because it's a food product, it doesn't require, FDA approval, or somebody doesn't have to approve it. So that is why so many studies are having so many different outcomes of the studies, and the meta-analysis people are having a problem uh, analyzing these RCTs, because the products are variable, their use is variable, their writing is variable. So that is why. One thing I told you, addition of a probiotics to soy. You can give any of those probiotics that you normally used, and there is a study which they have studied 36 subjects where when they added probiotic, it acted better. There was another Japanese studies where they straight away gave equal to these patients, and there it was much better than placebo, obviously, because the endpoint is equal anyway. Now, as I told you, isoflavones act fast, lignans will act longer. So they combined it and had an RCT with 80 women, and they found that better reduction of postmenopausal symptoms can be achieved over a 24-hour period. So you add your soya beans along with your flax seeds and you will get better effect. Other things, your soft that you have, it has shown that a vaginal cream containing soft was supposed to improve vaginal atrophy. And vaginal phytoestrogen preparations have also been studied to improve atrophic vaginitis, whether they contain soft or not. Phytoestrogen creams have been studied. I have not put it up in my slide, but I would like to say that. The methi that we have in our sambar, in vivo animal studies has shown that it improves metabolic features and corrects inflammatory alternations associated or attributed to phytoestrogen compounds. So you add this methi to your phytoestrogens, it will help, and so a placebo control trial has also been done in 2007. Pomegranate is supposed to reduce the fat levels. So it will reduce the fat levels and it will improve your vascular wall penetration. So it will thus improve the vasomotor symptoms, and it is also going to improve the disorders of cardiovascular and respiratory system. So estrogens, as you know, even from the WHI trial, is actually going to decrease the amount of breast cancer. It's a progesterone which is a problem. Therefore, the antiangiogenic, antimetastatic, and epigenetic effects of phytoestrogens can prevent or even reduce breast cancer by competitive inhibiting breast cancer cells. So this is what they have found in 2018. Even sexual dysfunctions can be removed with some of the phytoestrogens. Endometrial thickness is not affected. This is Maturitas 2019. So now more and more studies are coming up, although we do not have comparative studies. Now finally come down to cardiac illness. We all are scared of the cardiac illness as we come to menopause, and we should be eating right, staying happy, doing exercise, all that is good. But how should we be eating? What should we be eating to reduce the cardiac illness that is going to come more after we come into menopause? One should avoid eating trans fatty acids, partially hydrogenated vegetable acids, like all your vanaspatis, They increase the bad cholesterol, LDL cholesterol, and will decrease the good cholesterol, HDL cholesterol. So all the biscuits manufactured with vanaspati containing trans fatty acids should be avoided. Your own good old glucose biscuit is going to be good, so that you can eat. Cream biscuits, cookies, samosas, all these things to improve the taste, whichever brand is using, even your cake, all your everything that uses vanaspati type of things, so that it tastes a lot and it melts in your mouth and you feel very good. But those trans fatty acids can actually increase the incidence of heart attack. A 2% increase in energy intake from trans fatty acid has been associated with a 23% increase in the risk of heart disease. Of course, if you laugh a lot and you help a lot of people, that 23% will be, if you laugh all the time, then maybe that 23 will become 50, come down to zero. So people who are happy all the time, so all those things affect your incidence of getting illness. But basically, when you think of eating trans fatty acid, eating samosas will make you prone to getting illness. And another thing is repeated heating or frying can lead to an increase in trans fatty acid content. That's why you see, you always say that when you eat food from outside, you are bound to get ill. Why is it that? Because you are always eating the same food, no? The same samosa you cook at home, it's good. The same samosa you take from a hotel, it's not good. Why? Because they will use the same oil again and again because they need a long volume. Whereas in our houses, we would use of oil and you will finish it off, wash off the vessel, and then you will put the next oil. Max to max, you will use it 2 or 3 times. You are not going to pour. Another thing is, suppose you have little oil left in that burden. You either throw it off or you finish it off. Don't pour more oil into that vessel without washing it off. Because if that reused oil is there in the vessel, it will mix up with the remaining oil, and then that will again increase the trans fatty acid content, and that will increase your propensity to get a cardiac illness. So basically, you have to reduce the trans fatty acid content in your food. That is there. And so that's what FSSAI clearly states, that should not be more than 2 or 3 times. Another thing is coconut oil. It is rich in medium chain triglycerides that are largely used by the body for production of energy. It contains lauric acid, and lauric acid in coconut oil is very good for health. So the chance for that to be stored in your body is less likely. So it will get expelled faster, and it will make you have less abdominal fat. That's a good thing. So earlier we used to think coconut oil is a bad thing, but lot of information is coming out. I'm not saying this because I'm a Malayali and Kerala gets its name from Kera, which is coconut. But this has been proved even in BBC News it has come. So coconut oil is supposed to be a very good oil for you. Now, visible fats in the diet, such as ghee, butter, or oil, should be less than 50 grams per day. Eat more fruits, vegetables, dry fruits, and fish, which are very good fats. Never go hungry. One of the best tips to keep in mind when it comes to cutting out bad fats is to make sure you are never famished. So hunger can cause us to crave for things that we normally wouldn't eat, especially foods that contain a lot of sugar. So you eat 6 times, but eat correct food. So when you're eating that 6 times, you reach out for high protein food, high fiber snacks throughout the day between the meals, so that you don't go hungry, but then you don't add up to your calories. But if you go famished, even if you eat those high fiber and high protein diet, you won't be happy because a craving will come. So you do not need to have that craving, and for that reason, you should not have fasting and feasting way of eating. You should have, in between eating for low calorie foods. So I never tell my patients to go hungry. I tell them don't go hungry, but eat right instead of going hungry. Now, some of the things that are good for you not to have get heart attack is your biryani ka, this, cinnamon thing. Almonds, when eaten in moderation, is known to lower the cholesterol levels. And they also contain vitamin B7, E, and minerals like magnesium, iron, zinc. Vitamin K in tomatoes help to prevent occurrences of hemorrhages. So that's good for your old age. And tomatoes, in fact, were thrown out as dirty food. They thought it was poison when it was initially found. And then later on, people started realizing the importance of eating tomatoes, not only for vitamin K, even for vitamin C. Oats. We all substitute oats a lot in diabetes because it contains beta glucan, which is a soluble fiber It helps to bring down the cholesterol level, especially the LDL in the body. So that's how oats work, by bringing down the cholesterol levels. Again, all your cereals and your fruits can help reduce your propensity to get heart attack, which is very important in menopause. So instead of worrying about, people sit in their tables and wonder, oh God, how scary is that radioactivity from Japan? You worry about all hi-fi things all around the world that can improve, worsen your health, and you worsen your health by eating, smoking and eating wrong food and eating junk food and drinking colas and things like that. And in midlife, you will invite hypertension, diabetes, cardiovascular disease, anemia, hypothyroidism is already there, osteoporosis and malignancies. If you eat right and exercise, then this will not happen, and you should not be worried about small things. You should be worrying about things around you which you can easily manipulate. So, to finally conclude, the correct dose of phytoestrogens in the presence of bacteria in the intestines. And when you choose a product, you take tablets containing adequate active content. If you do that, then these tablets can relieve hot flashes, relieve osteopenia, improve lipid profile, reduce BMI, and improve diabetes. But when one phytoestrogen does not act, you cannot blame all the brands. If that doesn't act, you may try out another brand. Or even if that brand by itself may act in another woman because she has more bacteria. So you cannot write it off, although you cannot rely upon it all the time, because there are a lot of variabilities, as I told you, and you have to keep that in mind, and you have to use phytoestrogens judicially. Thank you so much for this patient hearing and this opportunity to interact with you.
Thank you so much, ma'am, to give this important information regarding importance of phytoestrogen and various nutrients to be taken intake as a part of menopause treatment. And I think the participants have got lots of information on this topic, and we are glad to have you on this platform today. So let me check if we have any query in the comment section. So, ma'am, there is one question that what is the dose recommended for estrogen?
Estrogen, I think 1 BD.
1 BD. Okay. And, ma'am, is there any advantage of isoflavonoids in the treatment of menopause?
That's my whole talk about isoflavones or
Yeah.
phytoestrogens can reduce hot flashes and reduce the osteoporosis and improve diabetes and everything, but only in people who have good gut bacteria in them, because isoflavones require gut bacteria for conversion into equal. And equal is a final product which will act by reducing hot flashes. But when a patient comes with severe hot flashes, straight away, if you put them on isoflavones, I don't know if it will act. If the patient can afford, means she is a younger woman. If she comes after 60, you can't give estrogen. So in those women where estrogen is either contraindicated or relatively or absolutely, there, even if she has got severe hot flashes, you may have to give alternate therapy like isoflavones. Otherwise, when patient is already on or in other patients where they have been on hormone therapy and they are little scared, whatever you say, they are not getting convinced. These are the patients where you can give in phytoestrogens.
Ma'am, there is one more question that can we prescribe estrogen and estrogen together, and does it help to cut down dose of estrogen?
I have not tried in my practice. In my practice, because there are no comparative studies of estrogen with estrogen. Estrogen is supposed to be a non-estrogen, and logically, what you're saying is correct.
Yes.
But if you give, I have not tried it out in my practice, nor are there any comparative studies, or maybe on an RCT basis, or telling your patient that I'm trying it out. Maybe you can try it out as on a research basis, but I cannot give that to you as a guideline basis.
Yes. And ma'am, one more question that what kind of exercise can be done by postmenopausal women?
See, postmenopausal women will have a lot of exercises. One are cardio exercises.
Mhm,
Some exercises are breathing exercises. You have to go to a proper trained gym person because
mhm,
various muscles have to be activated. So cardio exercises are good for your heart, and the aerobics exercise, like you try to get up from a chair and your hip bones and hip joints and all those things have to be activated. So for that you have another set of exercises. So you have to actually have many types of exercises,
mhm.
which you, and arm exercises have to be there. So you have to go to a proper physio to really know which are the types of
Which kind?
exercises for which uh, your body needs to do it, whether you are a cardio person, whether you are a person with a lean body mass. So all that depends on that, and a trained person can tell you. You have to individualize. You cannot just globally say you do this exercise for postmenopause. That you cannot.
So, like exercise like yoga can also help in
Yes,
this.
yoga also has got all these components, whether it is
Mm,
physiotherapy, whether it is
mhm,
yoga, all of them have these components, cardio, physio, that way. There
mhm.
are many groups of exercises for each person. You have to individualize and do.
Thank you, ma'am, so much for giving answers for all the questions. And I cannot see any more questions. Okay, one more question is there from Dr. Sudhamani. Uh, is there any adverse effects of isoflavones who are on counter available if it is used for long periods?
Madam, we really do not have studies on this, and that's why they are little skeptic in giving guidelines that they do not have any side effect. Because long-term studies are saying that there won't be breast cancer are not there, and there basically breast cancer.
Hmm.
When you give HRT and the breast cancer rises, it starts immediately. When you give HRT and when you stop HRT and the breast cancer comes down, it stops immediately. That means what? It has not started immediately or stopped immediately with HRT. This cancer must have been there for a longer period of time, and it has only increased with the HRT, or when the HRT was stopped, that increase was stopped. Therefore, even for isoflavones, you need very long studies to prove this. We do not have long-term studies on this, and that has to be an honest answer. We do not have that much long-term studies, and we cannot say absolutely that this has not happened. And because it is a food product, the studies are little slow in coming, and because there are so many variabilities in the products, so which product you will say that this is good and that is good? So it's difficult to have those studies come into play. But there are many meta-analyses and they are trying to study them. For X product or Y product, we do not have long-term results.
And one more question is there
I
that
remember one
what
gynecologist
is
saying that her mother's migraine came back when she started using phytoestrogen. Because when you're with menopause, your migraine goes off because the fluctuations in estrogen is going on. And then suddenly, after some time, she started giving this, she had some phytoestrogens lying on her table and started giving them. And her mother started getting the migraine as attacks again. So you cannot just say that because it is a plant estrogen, it has no effects or side effects. We need more studies for that. Yeah. Yes. You were
uh,
asking something.
yeah, the other question was that what is the role of antioxidants in menopause?
It's the same thing. All antioxidants will have anti-inflammatory activity, and these cytokines, leukotrienes, all these things rise, and they can cause obesity. They can worsen your immunity. They can cause atherogenicity. So, even osteoarthritis, where these things can cause osteoarthritic implants. And when you have osteoarthritis, menopause by itself you will have osteoporosis. Along with that, when you have this pro-inflammatory arthritis, you cannot walk. When you have arthritis, you cannot walk, and then the obesity increases. When obesity increases, your metabolic parameters will worsen, which will cause more heart attack, more diabetes. So you need less inflammatory markers in your body to stay fit. The inflammatory markers in your body will reduce when you have antioxidants in your body. So it starts with a small thing and then it goes on to a higher things, higher things, higher things. So you really need to work upon raising your oxidative, you should have good antioxidants in your body. So the oxidative, you know, uh, attack on your cells are less and you have less inflammatory markers in your body.
Thank you, ma'am. And one more question from doctor is estrogen is a phytoestrogen and how long it can be used?
I am sorry that I did not find any studies on that, how long it can be used. And I tried, I only could find 1, 2 RCTs on this, and that's all that. If this company people can give any more information, I would be happy to hear them. Because I did not find any long-term studies, only 2 RCTs I could find. That's all.
Thank you, ma'am, so much for giving all this information. And so there are no more questions now. Thank you so much. And we will like to have you again in this platform, Shield Connect, in future.
Okay. Yeah.
And
Thank you, Shield.
I also thank all the participants to join today's webinar, as well as I thank all the colleague members who helped in make this webinar possible with Dr. Shobhana. Thank you so much, ma'am.
Thank you, Shield.
Thank you very much.
Thank you. Shall I leave now? Thank you so much for this opportunity.
Thank you, madam. Thanks a lot.
Thank you, ma'am.
Thank you. Bye.